My name is Dr. Ajay Shetty. I'm a senior consultant and head of Department of Renal Sciences in the Department of Urology. And today I'm here to talk to you about another common condition that affects urology practice. Particularly, we are talking about male urology problems, and that is the prostate gland. Now, prostate is a walnut-sized gland present just below the bladder. It envelops the upper part of the urine passage. Therefore, the urethra has to go through the prostate and then exit, and one passes urine through the penile urethra. Now, there are many common conditions that affect prostate gland. One is the inflammation of the prostate called prostatitis. The second is the benign enlargement of the prostate, which is traditionally known as BPH. And the third is the aspect of cancer in the prostate, which is the dreaded prostatic cancer. Now, it's very important to realize and recognize symptoms of prostatic disease because early recognition gives you prompt treatment and cure. So how do you recognize a prostatic problem? Urinary symptoms typically in the form of poor flow and reduced stream of urination, inability to control the urination and the sense of urgency to rush to the bathroom, intermittent flow of urination versus a continuous flow, and a sensation of incomplete evacuation of the bladder. Now, these are common symptoms that one can attribute to the prostate. Presence of any of these symptoms would warrant a visit to the urology department and investigation by a urologist. At Sakra, we have all the facilities for a prompt evaluation and treatment of prostatic conditions. Patients who come to the outpatient department will initially have an ultrasound being done in the OPD with a urine flow test, which is called uroflowmetry, also being done in the OPD. Now, depending on the diagnosis that one has achieved, the treatment has to be accordingly. Majority of patients with benign prostatic hyperplasia can be managed with medical therapy. However, there are some patients who come in a little late in the disease process, at which point surgery can become essential. Our operating rooms are equipped with the latest generation endoscopes and a 100-watt holmium laser to assist prostatic surgeries for the enucleation of the prostate. So, as far as prostate cancer is concerned, again, diagnosis of prostatic cancer can be based on the made of physical examination, PSA, which is a blood test that we have to do, and if necessary, a transrectal ultrasound guided biopsy of the prostate. These are the ways to detect the prostate cancer, and the management, be medical or surgical, will be dependent on what stage the diagnosis is made. And please remember, early recognition means prompt treatment and cure.